Very good evening, friends. Meeting again in the session of Robert's philosophy. And yesterday we have finished one more chapter from the psychotic miasm, the overconstruction, and a postulate regarding it. Today we're going to summarize whatever we have learned right from the chapter number 22 from H.A.Robert, where he has started disease classification. And he has concluded it in this last chapter, that is the 31st chapter. So 10 chapters are devoted to disease classification, where he has highlighted all three basic miasms in comparison with the cancer miasm, that is psychosyphilitic or pseudosyphilitic tubercular miasm. These 10 chapters from H.A. Roberts gives you a complete view to look towards the miasm, and most practical way he has tried to explain the miasms over there. So this chapter, the last one, it is only one page. It is just a summarizing what we have learned up till now. So let us start with chapter number 31, the disease classification, a summary. Let us summarize the different stigmata, remembering that we may get all shadings of all the stigmata in their groupings in our patient, but one stigma will predominate above all other. Generally, we used to get all three miasms in patients. Even we carry all three traits in us, but at a one time, one is dominating. Every time it is not all the three gets dominating, one is dominating. They all have their characteristic differences. The accentuation of Sora is functional. Again, underline, these are the common traits. The earlier chapter he has labeled it, the earmarks of Sora are functional. So it is the characteristic. All manifestations expresses in the form of functional manifestations, means the pain is the characteristic of Sora, where you cannot find it out exactly or locate any pathology. Generally, pathology, if it is there, this is again acute inflammatory, but not more than that. That's why it is called as functional manifestations. So Sora accentuates as a functional. The accentuation of syphilitic tent is ulcerative. That's what we have learned in last chapter also. That syphilitic miasm, the characteristic or earmarks are ulcerative stages, the bony affections, bone involvement, that is the characteristic. And third important thing, the accentuation of psychosis is infiltration and deposits. So overgrowths, infiltration, deposition, this is the characteristic of psychotic miasm. That is an earmark of psychotic miasm, on the basis of which it becomes rather simple to differentiate what miasm patient belongs to or what miasm is dominating in your patient. These earmarks are nothing but the primary manifestations of those three miasms. When suppressed, the syphilitic stigma spends itself on meanings of brain, meninges of brain, and affects the larynx and throat in general, the eyes, the bones, and the periosteum. So whenever the syphilitic primary manifestation, that is a syphilitic ulcer, primary sore, gets suppressed with the help of some local measures, it gets transmitted, expresses in the brain, in the meninges. It goes into the bones, producing bony pathologies like osteomyelitis, like bony affections over there, osteomalacia, the destruction of bone tissue, necrosis over there in the bones, or it affects many times the periosteum and eyes. Sora spends its action very largely upon the nervous system. When soric manifestation, the primary itch, is suppressed by local measures, it goes to the nervous system and nerve centers, producing functional disturbances which are ameliorated by surface manifestation. Patient develops a neuralgia, and when it goes to the brain, producing very severe neuralgia, and if you try to treat that with the help of antisepsoric remedy, then that neuralgia will settle, and primary manifestations, that surface manifestation, the itch reappears over there. So nervous system affections, but the functional manifestations are always sore. For example, there is a patient who had a very severe boils or very severe vesicular eruptions on the body, which were oozing a lot, itching a lot, and that fellow has taken a local skin treatment. With the help of that ointment, it disappeared. It vanished within span of 3-4 days, and nothing will be there. Nothing was there. In the span of 15 days, that fellow had developed an epileptic attack, which was not there till death. So it was transformation of the disease from less important organ to the more important organ. It is psoric epilepsy. Because it was functional, EEG was normal, brain, even MRI was normal. There was nothing found, nothing located, but patient had an epilepsy. This is functional epilepsy because of suppressed skin eruption. So disease was getting transformed from less important organ directly to the brain, from skin to the brain, and produced an epilepsy where nothing is found. And then you can think of Ginkgum metallicum, Cuprum metallicum as a remedy. If you give right remedy, the surface manifestations will return back. And if it returns back, you have cured that epilepsy. This is the psoric epilepsy. Third one, psychosis attacks the internal organs, especially the pelvic and sexual organs. This is commonest sphere of action of psychotic mild. In this stigma, we find worst forms of inflammation, infiltration of the tissues, causing abscesses, hypertrophies, cystic degeneration. See, the pathology when enters inside in psychosis, so suppressed gonorrhea or suppressed pigworts can give rise to such types of pathologies where inflammation is of worst form. There is an infiltration causing abscesses, hypertrophy, cystic degeneration. When thrown back into the system by suppression, this stigma causes dishonesty, moral degeneracy, and mania. So if the secondary manifestation again gets suppressed by some suppressive measure like surgical measure, it enters into the brain, specifically into the mind, and it produces moral degeneracy. The person becomes criminal. He becomes more liar. He becomes more suspicious. He becomes more dishonest. And this is how it travels. So the primary manifestation, if it's suppressed, goes to secondary stage, if suppressed, goes into the tertiary stage, and this is how disease goes or progresses more and more to the deeper level. In treating patients suffering from the stigmata, this classification is of inestimable value, for it immediately throws the simillimum into class of remedies corresponding with the accentuation of the stigma that is outstanding in the case, and this should be considered in totality. It will often throw light upon the choice of a simillimum that is applicable to the individual case and stage of development. Yes, sir. There was a question by Satyanarayana sir that even removing the warts will bring, sir. Yes, it will lead to the secondary stage of psychosis. If you remove the warts by local means, by cautery, by acid cautery, or by electric cautery, or by surgical removal, it leads to the secondary psychosis and it enters inside. What he said in this specific paragraph, he said over there that with the help of all those whatever he has taught over there in regarding these three miasms, it becomes rather simple that in which miasm this patient belongs to. That one must know. We have to differentiate what exactly disease is there, how much deeper pathology is there, in which miasm does it belongs to, and whatever the totality you have collected or selected, you have, if you repertorize, you have to look towards the remedies which has that specific miasm. Then and then that patient will be cured, otherwise not. Generally what happens, if we don't look towards the miasm, the problem which happened in case of Hahnemann, we will suffer from the same thing if we don't understand the miasm. I will take a simple example of it. If the patient comes to you with a semilateral headache, right-sided headache, which is getting aggravated, looking towards the light, aggravated because of noises, it is very severe throbbing type of pain. It gets aggravated even in sun. And this fellow was there under allopathic treatment since last 10 years. Earlier, it used to happen once in a while. Later, it started getting once in a month. Now, then it's once in a 15 days, then once in a week. And now it is patient is suffering from it since daily. And he's having very severe problem. If you look towards the modalities and if you repertorize, you're going to get very simple remedy. So what's that remedy? Headache, semilateral, throbbing, pulsating, aggravated, looking at light, aggravated by noise, aggravated by sun in the sun. If we'll take into consideration, very simple remedy comes to be belladonna. But if the patient's problem is there since last 10 years, belladonna doesn't have that specific strength to cover the whole totality. Here the miasm is necessary. Here it is not a acute miasm, it is a chronic miasm and it belongs to the psychotubercular miasm. If we understand this, then we can think about this. This is not a belladonna because belladonna is very short in action. It has only 1 to 7 days action. And belladonna is not the remedy which will suffice to cure that patient. Yes, belladonna might palliate that patient, but will not cure that patient. So remedy in such types of cases should be from psychotubercular miasm. And as Nikita has mentioned over there, netremur, yes, it is netremur. One can think about that. So depth of the remedy should be judged on the basis of miasms. This is what he wants to explain over there in that paragraph, that with the help of understanding miasm, it becomes rather simple to reach to the remedy. And to conclude the chapter, what he says, when we are considering case manifesting mixed stigmata, there is always one more prominent, and this will be one requiring relief. When this is relieved, the next in the prominence must be cared for until the patient is freed from the inheritance of generation. See what he has said, very important entity which he explained over there. There might be a 2 day generation, we have mixed miasmatic cases. We don't have simple miasmatic cases. Now we have complex. We generally get tubercular, that is pseudosyphilitic, or we generally get cancer, psychosyphilitic miasm. So if such a thing is there, then what one should do? That whatever is dominating that you treat first, and then after relieving that, the next one which will come up, that you have to treat, and then you have to free that patient from the miasmatic focus. But now we have ample remedies which covers the both the traits at a time. We have more than 3,000 remedies in our Mater Medica, which were only 99 during Hahnemannian time. So this method was necessary at that time. But today, as we have ample remedies to tackle the situation, we have remedies which covers both the miasms at a time. So we have psychosyphilitic remedies, we have pseudosyphilitic remedies. And if simillimum is matched with that remedy, there is no need to alternate the remedies like this. So this was the summary of miasms. Many lectures we have spent on these 10 chapters, right from 20 to 31, and we have learned a lot about the miasms over there. H.A.Robert has mentioned miasms in such a nice manner so that it becomes rather simple to understand. So that's all for today. Tomorrow we'll start with the very important chapter, that is homeopathic therapeutics in the field of endocrinology, chapter number 32. It's a big chapter. Many lectures will be required, and it is most clinical part which we're going to learn in this chapter and most useful in our day-to-day homeopathic practice. So be there at the same time with the new chapter from H.A.Robert. So thank you being there and good evening.
Thank you very much, sir.
Thank you, sir.
Thank you.